At the moment, we have a divide between the federal government and the state and many state governments' characterization of marijuana. We have the federal government, which in 1970 categorized marijuana as a Schedule I substance. Under the Controlled Substances Act, it is illegal, considered ripe for abuse, and has no accepted medical use. And so activities related to marijuana are illegal. In the states, we have two different dominant legalization regimes going on. 30 states and DC have legalized medical marijuana, 9 states and the District of Columbia having legalized recreational marijuana use. There's a number of problems with having this divide or chasm between the federal law and the state laws. One of the most important ones is that we don't have a consistent and predictable regulatory scheme at the federal level, like we do for other controlled substances like opioids, or even for tobacco, which FDA has jurisdiction to regulate now. Without having any standardized federal scheme, we have this situation where we have different products propping up in different jurisdictions and not a great understanding among consumers or prescribers who might be wanting to recommend things to their patients for medical use of what to recommend, what to take, what is in these products. We laid out essentially 3 options for resolving this federal-state divide. The first would be to reschedule marijuana as a Schedule II or Schedule III substance. Another option is to deschedule marijuana altogether. That would potentially be akin to tobacco, where that is not a scheduled substance, but is regulated by the FDA under other legislations. The third, what has actually been proposed now by Senator Elizabeth Warren of Massachusetts, essentially says the federal government, with respect to the Controlled Substances Act, is going to exempt out those state legal activities, marijuana-based activities, in the states where they're legal. The challenge now is, even were the Warren bill passed and we sanctioned what's happening in the states and at the federal level, we still have problems associated with the safety of marijuana because it's not regulated at a federal level. We have problems with spurring research around the safety, the harms and benefits of marijuana, potential issues with international treaties. Even if we were to sanction the situation and what's going on now, we're not going to be addressing a number of the conflicts of laws and just social issues associated with marijuana use.